If you have chronic knee pain that limits your activities, osteoarthritis may be the cause. Medications can help with the pain, but long-term use could result in a number of side effects. Steroid injections might also be helpful, but repeated steroid injections have their own set of health risks and need to be repeated. For patients considering a knee replacement, there is now another option. Genicular artery embolization is a cutting-edge, minimally invasive procedure used to treat knee pain caused by osteoarthritis or bone-on-bone disease. It can effectively reduce pain and inflammation for 2 to 4 years. Some patients have reported up to 6 years of relief. A clinical study performed in 2021 showed that on a 10-point scale, the average pain scores decreased from an 8 to a 3 within a week of the GAE procedure. If you or someone you know is suffering from chronic knee pain, learn more about genicular artery embolization. Call or visit our website today.